Welcome to the final section of our IV therapy training, summary, and conclusion. In this brief wrap-up, we'll revisit the most important points covered throughout the course and emphasize the core principles that will guide your practice in IV therapy. Let's begin with a recap of the key principles we've discussed. 1. Patient assessment. Thorough screening of medical history, allergies, comorbidities, and lab results to ensure safe IV administration. Identifying patients who are suitable candidates and recognizing contraindications early. 2. Proper technique. Aseptic preparation, accurate cannulation, and correct drip rate calculations. Consistent site monitoring for infiltration, phlebitis, and other complications. 3. Drip formulations. Familiarity with various IV solutions, normal saline, lactated ringers, dextrose in water, etc. Understanding popular recipes, such as the Myers cocktail, high-dose vitamin C, or glutathione infusions while verifying dosage, compatibility, and patient suitability. 4. Safety measures. Maintaining a sterile environment, utilizing personal protective equipment, and adhering to sharp safety protocols, recognizing early signs of systemic complications and having emergency procedures in place. It's vital to remember the emphasis we placed on adhering to clinical guidelines. Always rely on evidence-based protocols and best practices for IV therapy. Keep updated on the latest recommendations from reputable sources like professional medical associations or regulatory bodies. Local regulations. Each state, province, or country may have different rules for IV administration, licensing, and delegation of duties. Ensure you understand scope of practice laws in your jurisdiction and maintain all necessary certifications and documentation. By consistently following these guidelines and regulations, you protect both patients and your practice. The final takeaway is this: IV therapy can greatly enhance patient care and expand practice offerings when done safely, ethically, and with high standards of training and oversight. By incorporating what you've learned from thorough patient evaluation to proper documentation, you'll deliver effective, trusted treatments that improve patient outcomes. As you move forward, continue refining your IV skills through practice and continuing education. Foster a culture of safety, encouraging your team to report concerns, share insights, and stay updated on new research. Remain patient-centered by prioritizing individualized care, clear communication, and ongoing patient education. This concludes our IV therapy training. I hope each of you has gained valuable knowledge and confidence to implement safe, effective IV treatments within your scope of practice. Next steps. If required, complete any post-course assessments or simulations to validate your proficiency. Arrange hands-on practice with trained supervisors if you're new to IV therapy or looking to enhance your skills. Remember to keep learning. The field of IV therapy continues to evolve, and staying current will ensure the highest standard of care for your patients. On behalf of everyone involved in preparing this course, thank you for your attention and dedication to advancing patient care through IV therapy. If you have any questions or need clarification, I'm happy to discuss them now or at any time in the future.